All right, well, we are going to kick off your 2019-2020 open enrollment season. Thank you guys for joining this webinar session. And I believe Emily has passed out a few cards to write questions on. And we will be answering any questions that come up at the end. You can feel free to send them throughout the chat box, but I can't guarantee that I'm going to be checking the chat box throughout the session. So, welcome to the 2019-2020 open enrollment. The San Jose Episcopal Day School open enrollment will begin next Monday, January 28th, and run through Friday, February 1st. This is our 17th annual open enrollment, celebrating 17 years of service to our private Florida education employees. And we are happy to announce that we are representing open enrollment for 27 employer institutions this year. ICUBA is tackling the biggest challenges. We exist to provide our members with better access to cost-effective care so members can engage in high-quality ICUBA benefits. Our ultimate goal is to improve the health and well-being of outcomes for our members through access, engagement, quality, cost, ultimately hitting those outcomes. Janelle, I'll turn it over to you.
Yes, thank you. So one of the things we wanted to do also today is just to give you a little bit of information about our plan and how it works. So do you know that ICUBA medical plans are self-funded? So what that means is that all claims processed by our medical, pharmacy, and behavioral health brand partners are collected from your premiums, and those dollars go towards your benefits. So ICUBA keeps all premium dollars saved for the exclusive benefits of our members. We spend those premium dollars only on benefits for you. And this plan is really unique because it's designed by educators for educators. So we're really trying to drill down and kind of focus on your needs. And we also invest in a long-term culture of well-being so you can be the best version of yourself that's possible. We also establish some programs and efficiencies to help us kind of mitigate our claims. And a few of those are Blue Distinction Total Care Providers. When you all go to see a Blue Distinction Total Care Provider, there's a $0 copayment for those office visits. There's also $5 teledoc visits. We have low prescription drug and copayment structures. And we also each year encourage all employees to get your biometric screening so that you know your numbers. Another program we have in place is case management and care consultants. They'll be the ones that will usually be calling you. If you get a call from them, we encourage you to please answer. They are wanting to provide you with assistance or perhaps help you through some difficult situations. Some other programs that we currently have in place, we have ICUBA Cares, Teledoc, Rally, Resources for Living through Aetna, and we have a new program this year, Surgery Plus. And so what can you do? We have a call to action for you all. We need you to be smart consumers and advocate for yourself. Make sure you're taking advantage of your free preventative care screening so that you know your numbers, where you're at. Register for Teledoc. We also encourage you to do that ahead of time so that if you're sick, no one feels like registering then. So go ahead and register now so that if you have a sore throat or maybe a sinus infection, you can hop right on and get in contact with a doctor. We also have ICUBA Cares. You can give them a call to see if they can help you with lower prescription costs, maybe some discounts. You're also given 6 free EAP sessions to meet with a counselor, get some advice. Those sessions don't necessarily have to be about, anxiety or depression. They also help with many different things that you could be going through or experiencing in your day-to-day life, where it's with parenting, things with the parent, finances. So if there's anything that come up that you're struggling with, feel free. We encourage you to take advantage of those 6 free EAP sessions. We also encourage you to get your free preventative skin cancer screenings, so you can visit a dermatologist to set that up. Also, use that Blue Cross and Blue Shield pricing tool so that you can know before you go to the doctor what that screening or what that procedure may cost you. And lastly, join your Rally City Challenges. You can sync it with your Apple Watch, with your phone, and that will give you a chance to perhaps win a $50 Amazon gift incentive. So we encourage you to get engaged and use your benefits.
All right, so from the annual survey that IQVIA conducted a few months ago, we found out the main concern for our members is cost. So we did some research, and in this comparison, you will see the average employee-only cost of a member is lower than the education industry and everyone else. The way that we determined this is we did a few adjustments for demographics, location, and plan value. So we found out that our population covered by the IQVIA benefits is slightly older than average. We also cover less families, and a lot of our employees elect that employee-only coverage. Florida, you may or may not know that Florida is also more expensive than many other states for the healthcare industry, and a lot of our costs are higher than average across the country. And the IQVIA plan is a richer benefit. So with all of these odds against us, through this process, we found out that we are lower on average than our competitors, which is really cool. So in addition to how IQVIA stacks up against the others, we put together this slide for you showing all the other PPO plans versus the education industry. This is us versus our benchmark out there. So because of IQVIA's innovation, a few of the things that Janelle was just speaking about, we discovered that IQVIA's 17% below the database benchmark average and 22% below the education industry benchmark average. This means that our plans are very competitive, and so we are working on that cost, but it all comes back to you. What else are we going to be talking about in this presentation? We are going to be covering enrollment and eligibility, perks offered by the plan, and our 2019 benefit plans. Chanel?
Okay, so when you're going to enroll, of course, you'll go to IQVIAbenefits.org. As Rachel mentioned earlier, your open enrollment period is from January 28th through February 1st. So during this open enrollment period, this is your chance to update your benefits for next plan year, which begins April 1st, 2019, and that'll go through March 31st, 2020. Any elections that you make during open enrollment will remain in effect until next plan year. If you have a qualified life event, you may be able to make some changes to certain benefits throughout the year, but this is your main time to get in there, see what benefits you have, what's new, what's different out there to make your choices for next year. Many of you who have enrolled before, you will be familiar with the Ask Emma feature. So Ask Emma, no more wondering which plan is right for you. With a few questions, you'll go through, and Emma is essentially a decision support tool that will help you make smart decisions, choose cost-effective benefits for your individual needs. Emma will ask you a few questions, and that's like a personalized walkthrough. And using these questions, Emma estimates your annual cost using real-life scenarios for your personal experience and premium contribution. Emma also has an FAQ features for frequently asked questions. If you're not familiar with what a DCA is, perhaps you can click on some information and Emma will give you details on what that plan is. It'll give you some rules attached to those plans. So I highly recommend using Emma if you have any benefits related questions. She's available in the top left corner of your enrollment, and she's available in both English and Spanish.
All right, so who's eligible for all the stuff that we're going to go over? We have pretty strict eligibility rules, but hopefully these fit your needs. A legally recognized spouse, a natural child, a legally adopted child, a stepchild, a child with a qualified medical child support order, someone that you have legal guardianship who resides with you, or a foster child. IQBA's plan is pretty cool in the fact that we cover dependent children up to the age of the end of the year in which the ages of 26 is attained. So if you have a dependent that turned 26 in January or February, they can still be enrolled in benefits effective in April, and we will let you know when December 31st is approaching and they will be removed from the plan. So I know everyone listening now, I'll read the fine print before you click the I agree button and submit your enrollment. But in case you missed this paragraph, you are verifying that all the dependents enrolled on your plan are in fact yours.
And again, this year we'll be holding an open enrollment sweepstakes. So through your enrollment, you'll be asked to confirm that your personal phone number and personal email address is updated and correct. So we encourage everyone to please put that information in there. It's important when our brand partners are trying to contact you, or maybe someone at IQBA is trying to get in contact with you for something. You'll be given another little checkbox that says, I agree, that you're agreeing that your phone number and email address is accurate. So we encourage all to do that. Everyone who goes through your enrollment and finalizes that process, you'll be entered in to win a prize. We also have a single sign-on through IQBA. So if you're trying to reach any of our brand partners, we encourage you to use this single sign-on feature so that you don't have to remember usernames and passwords for every site. These are on the IQBAbenefits.org homepage. They're right in the center, conveniently located for you. If you have a spouse, they will have to go to the direct login, but for employees, that single sign-on feature is there and available for you.
All right, so medical plan perks offered to you through IQBA's membership. We're going to talk about that new exciting benefit, Surgery Plus, and you've heard about some of these others before, but we're going to recap them just as a refresher. So we're excited to announce Surgery Plus is a new supplemental benefit. This is a supplemental benefit. When you elect the medical plan, you'll also be, it'll be accompanied by the Surgery Plus benefit. It takes into account they come with their own Surgeons of Excellence network that is, their network is comprised of licensed, board certified surgeons that have completed a fellowship, and they have the lowest complication rates. So with this service, Surgery Plus covers hundreds of medically necessary non-emergent plan surgeries, including but not limited to these listed below. So they are definitely something that you foresee coming in the future and can plan out. These are not emergent surgeries. So one of the cool things to note is starting on April 1st, if you go through Surgery Plus, you can actually have your coinsurance and deductible waived for any of these non-emergent procedures. We know surgery can be overwhelming, and Surgery Plus offers a full concierge service to kind of cater to your needs and answer any questions that you have along the way. Your dedicated advocate will locate the best surgeon for you. They'll actually pair you with 3 surgeons that fit the qualifications and the needs of your surgery. So if you need a knee replacement surgery, for instance, you'll call. The first call length is approximately 4 minutes. So in that first intake call, they're going to take some information from you. From there, they will work out all the details from scheduling and coordinating your files And then after the surgery, they're going to follow up to ensure member satisfaction. A few times that I've been asked, can I call right now? That answer is unfortunately no. This benefit is taking effect on April 1st, 2019. So in a few months you can call, but on that day when you make that first call to the time of procedure, on average, they estimate about 35 days.
We also wanted to review the Teladoc benefit, and there's access through the My Health Toolkit through Blue Cross and Blue Shield. So this is a telemessaging and video consultations with a doctor. This is available to employees and dependents enrolled in the medical plan. It's only a $5 copay. It's available 24 hours a day, 7 days a week, 365 days a year. We do encourage you to register now, but if you don't, you can still access that benefit. It's a fairly easy process. You may be asked for a company ID. For all ICUBA members, that company ID is ICUBA. We have the phone number here for you, so we just encourage everyone to take advantage of that benefit. And listed here are some of the top diagnoses that Surgery Plus usually provides benefits for. Also, we did want to make note that they do not write prescriptions for controlled substances. So if that's something that you think you may need, you'd probably want to consult your primary care physician. There are restrictions in place for the number of consults that you can have during the year. This benefit is essentially meant to supplement your primary care physician benefits. This is not to replace that. And we also wanted to remind you of the ICUBA Cares Pharmacist Advocate Program. Everyone there are, real pharmacists. They advocate for the members and they provide real solutions. We have really been hearing some really great things about ICUBA Cares. So if you haven't called them or reached out to them yet, if you're taking any prescriptions, we just encourage you to give them a call, do a prescription checkup. They can help you navigate preferred brands versus non-preferred brands on our tiers. If you're having to go through prior authorization, step therapy, quantity limits, they are there to assist you with those processes as well. And the number is here, but it's also on the back of your Optum Rx prescription insurance card should you need it.
All right. The Blue Rewards Powered by Rally program is a big hit every year. So the program is unchanged this year. We've just added a few ways that you can earn more coins. The Gatekeepers is still in effect. If you have not finished your Rally survey so far for the 2018-2019 year, I would encourage you to go back in, log into Rally, and find that survey to go ahead and complete it. So in the event that you've gone for a wellness exam this year, you can get your $25. But that same gatekeeper will exist in 2019-2020. We increased the coins for the Rally survey in the next plan year. We also added Rally coin incentives for Teladoc registration that will date back a few years to Teladoc's inception. So if you already registered for that, we're still going to give you those coins. Tobacco attestation and clinical rewards. If you are identified with one of these chronic conditions, when you log into Rally, you may see a new incentive customized just for you. This new incentive is to help educate you on your condition. You can choose to participate or not, but this goes back to you kind of taking control of your own health care. And we just want you to read through the materials, participate with a health coach if that's one of your objectives, and then each quarter you'll be incentivized with up to 500 Rally coins or 2,000 Rally coins each year. We are conducting city challenges with those private sweepstakes again this year. So if you are walking a lot and checking in to those missions and syncing your device regularly, you can be a winner of a $50 Amazon incentive. I'll give you a little sneak peek. There's no limitation or restrictions on how many times you can win. I sent an email today letting a woman from Rollins College know that she had won for a second time. So go ahead and sync your device, and best of luck to all of you.
Okay, so now we'll get into details of the medical, prescription, and behavioral health plans that are offered through IQVIA. And then get the care you need. We just want to outline here some of these services that are available. We mentioned before the primary care office visit. This will be kind of your first stop to your everyday health needs. If you're seeing a Blue Distinction Total Care provider, that's a $0 copay. And then depending on the plans you're enrolled in, I think for you all, it's a 20% coinsurance. We also have Teledoc, which we mentioned before, which is the $5 copay. There's convenient care, that's like a CVS Minute Clinic or one of the Walgreens clinics. If you're going there, it's a $10 copay. And then, of course, for urgent care, the copay structures are located below as well. And then we have the emergency room copay. That's $300. That's waived if you're admitted. We just want to kind of highlight where you'll be most likely to go depending on your circumstances. We also want you to be mindful of those freestanding pop-up ER clinics that look like urgent care. I think they're specifically designed to look like urgent care. So just be mindful of those. You'll go in expecting an urgent care copay, and then you receive a bill for $300. And then there are the health management and care consultants. I mentioned this briefly earlier. If you receive a call from them, please take that call. These are trained health advisors and registered nurses. They can provide you with tools, education, and advocacy to help manage your chronic conditions. They will assist you with setting and meeting goals. If you have an issue with a treatment that your doctor is prescribing, they can help you understand that treatment plan, support you with referrals, transition of care. So if you get a call from them, please be sure to take that call so that they can help you.
All right, well, we are excited to announce Blue Cross Blue Shield Care Connected. There was some feedback in that annual survey that we talked about a little bit earlier about customer service. So we've worked with Blue Cross to enhance their level of customer service to you. They've installed some new technology that will take if you call from like your cell phone when you call Blue Cross Blue Shield, it takes in the phone number that you're calling from, and it routes you to the same advocate if they're available. So if you're calling to follow up on an issue, it should automatically be routed to the same advocate if it is a day that they're in the call center taking calls. This is also a specialized team. So I say call center, but it's actually a very small, customized team of representatives that know our benefits and understand our benefits. IQVIA's benefits are very unique, so hopefully this will enhance the customer service experience for you with Blue Cross Blue Shield. Janelle also touched earlier on the Blue Distinction Total Care, those free primary care office visits. So if you're in the market for a new provider, when you're doing the provider search, just look for this Blue Distinction Total Care icon under the provider's name. You can also filter in the left-hand column and have it only show you Blue Distinction Total Care providers. But any medically necessary service performed in a family practice, internal medicine, or pediatric office with this designation are always free.
And here are our goal plans, and we just wanted to show you some of the similarities between the preferred PPO plan and, the Premier Copay PPO plan. So there are some changes this year. The deductible has gone up by $500. The out-of-pocket has gone up by $1,000. And so we just want you to be aware of those changes. And then we've outlined here some of the similarities and things that are remaining the same throughout both of the plans. And then we also wanted to show you these goal plan differences. So the preferred PPO plan has a copay structure versus the Premier Copay that has a copay structure, as it says. So when you're going through your open enrollment and thinking of your benefits, the choice is yours, whether you like the coinsurance or the copay.
So we introduced this plan last year, the $4,000, $8,000 deductible PPO medical plan. This was for the freedom for families with children to get a little bit of a break on their premiums, but it comes with a higher deductible. So we just want you to know the differences in these plan offerings. The deductible and out-of-pocket are significantly higher than the other PPO plans. The coinsurance and copays are higher. And while the premiums are much less, in a catastrophic event, it may end up costing you more in the long run. So we encourage you to really take a look at both of these plans. As you'll see in the top gold, these are the major differences from the other two PPO plans being offered. Those higher deductibles that are equivalent to the out-of-pocket in-network on this $4,000, $8,000 deductible plan, and then the higher copay structures. At the bottom of the screen, you'll see the items that are the same across all three plans. And if I flip over, this is in one slide, a quick comparison of the in-network only benefits. So the deductibles are going up to $2,500 and $5,000 for the preferred PPO and Premier Copay plan, but you'll see that in alignment with the $4,000, $8,000 deductible PPO plan. So this is just something to be mindful of when you're looking for benefits.
And then we wanted to let you know to be advocates for yourself, because knowledge is power. All these services listed here are not subject to the deductible. As I mentioned previously, the deductible is increasing slightly beginning April 1st, but we have so many benefits that are already available and out there for you that are not subject to the deductible. So we just wanted for you to take a minute to look these over. And these are the preferred and Premier Copay plans that the deductible is increasing. But as I said before, there's so many different things that are already available that are not subject to that deductible. And then these are the things that are that do apply to the deductible. Only major services apply. So if you're in a hospital, you're giving birth, perhaps you have to get some x-rays or scans, you need home health care, only those major services will be subject to the deductible.
The prescription drug plan is exactly the same as prior years. Just a reminder that a 90-day supply will save you money. We do the retail and mail order for the 90-day supply. So if it's easier to have it mailed directly to your home, then if that works for you, if you want to just run to the drugstore down the street, that is also an option. But a 90-day supply is for the cost of 2 months instead of for 3 months. The other thing that we just want to remind everybody about, we remind you every year, prescription drug freebies. If you are a diabetic, prescribed diabetic supplies are free. Prescribed aspirin for adults, generic folic acid, and prenatal vitamins. And if you're eligible for those statins, those are also free under the prescription plan. Optum continues to enhance their customer service tools, and their digital portal has gotten a few upgrades. So if you haven't visited the Optum portal through the single sign-on connection, I encourage you to do that. You can refill or renew your prescriptions, transfer them, find a pharmacy. It tracks your history in there. So if you're going to visit a new doctor, you can go straight into your medicine cabinet and print a list of your medicines to take with you. So there's no trying to remember what medicines you're on or what medicines you've been on recently. All the history is stored in one place. The mobile app is also very convenient as well.
Okay, so next we want to talk about the behavioral health and substance abuse benefits through Aetna. They have professional counseling. They can do a medication evaluation. They have applied behavioral analysis therapy for someone with on the autism spectrum. They also have intensive services, so if someone needs hospitalization or detox in a residential treatment facility, we have those services available through Aetna. They also have, and this started this plan year, a new Able To benefit. I personally have taken advantage of this benefit, and I found the experience to be worthwhile. You have free weekly sessions. There's a $0 copay for this benefit, and it's broken out into 16 sessions over 8 weeks. We have here some of the benefits or the conditions that are currently available through Able To. They have health conditions as well as life conditions. So you'll meet with a coach. They have sessions that are available over the telephone. They can also do web-based video conferencing. So if any of you fall into any of these health and life categories, I would say go ahead and check out the Able To program.
Aetna also covers our EAP program. The Employee Assistance Program does not have to be tied to the medical. The Employee Assistance Program is what you get just for being an employee at San Jose. It is also available to the members of your household and any dependents that you have in or out of the household. They have several mobile apps available to you, so there is a mobile app slide later on, and I would encourage you to research some of these and get a leg up on your emotional well-being. The Employee Assistance Program is free and confidential. They provide emotional support, life support, legal, and financial. We already discussed those 6 free sessions, but the cool thing about those sessions is it's 6 free sessions per issue per year. So if your students are driving you crazy, that's 1 session. And then your husband's driving you crazy, that's another 6 sessions. So take advantage of the per issue per year and really get the support that you need. The new benefit that's coming with that program is digital. You can now text your therapist on the go. On average, 1 week of Talkspace messaging is equal to 1 EAP session. So this gives you up to 6 weeks of messaging with a qualified specialist in that area. It allows you to send multimedia messages through text, audio, pictures, video, through a web browser or the mobile app. You can expect to hear back from your therapist within 1 working day. So it's not that immediate response that you get through a text message back and forth, but it does give you the ability to do it from your phone or mobile app on the go. The number one thing that you have to do in order to get started is you have to call Resources for Living for the authorization, and then you have to register at Talkspace or download that mobile app, but they do need to authorize that first visit. And it's also important to note that only dependents who are 18 years or older are eligible for this benefit, and non-California residents only. So if you live anywhere in the country other than California and you're 18 years or older, you're eligible to take advantage of this free Talkspace benefit. This is a snapshot of your medical contributions and premiums. I'm sure Emily will make this available to you, and it is also available in the IQBA benefits website when you're stepping through the process and completing your enrollment.
And so next we want to discuss your voluntary benefits. We'll be discussing IMED and Humana. So first we have the IMED vision plans. There's a base plan and a buy-up plan. The plans are fairly similar. The only difference between the base and buy-up is your frames allowance. If you're choosing that base plan, you can get frames once every 24 months versus the buy-up plan. It allows you to get frames once every 12 months. And then these are your monthly premiums for the vision plans. Here, as Rachel indicated, I'm sure Emily will make these available, but as you're going through the enrollment process, all these rates will, premiums will be available there for you as well. There's also some additional in-network benefits that we wanted to point out. If you're someone who has already exceeded your yearly allowance, they do have discounts, and they're listed here at the bottom on prescription glasses. There's non-prescription sunglasses, and then if you exceed the benefit, as I mentioned, you'll get a discount on anything above that.
Dental, everybody loves getting their teeth cleaned, especially 4 times per year. So if you're one of those crazy people like me that like getting your teeth cleaned a lot, the high option dental plan is the one for you. This allows you to get 4 preventive cleanings per year and 2 periodontal cleanings per year. It has a plan year maximum of $2,000 and covers up to $2,000 of orthodontics for each member. The preventive low plan is, it's important that you understand this is preventive and basic services only. It does not cover orthodontia benefits, and if you, God forbid, anybody has to get like one of those super painful root canals, a discount may be the only option for you. This is for preventive and basic services only. The DHMO plan is the third dental option available to you. This option is only available in Florida. So if you have dependents outside of the state of Florida, I would encourage you to either research the plan options that you have available, or if your kids are going to come home to get the dental services they need. But you do have to have a pre-selected provider under this plan. So if you are in the market and you browse their database and find a DHMO provider that fits your needs, this plan is actually a pretty good plan. They don't have deductible or copay or deductibles or plan year maximums. Sorry, I got tongue-tied there. And all dental services are reimbursed based on a schedule of benefits. This is just a small sample of their benefits, but they have like a 3 to 5 page schedule of every single dental procedure that you could ever need, and they're all outlined with a predetermined copay. And your dental premiums, which will also be available in the website when you're stepping through your elections.
Okay, and the wonderful ACA, we just wanted to review this again this year as well. IQVIA's preferred PPO and premier copay plans are equivalent to gold plans offered on the Marketplace Exchange. And then our $4,000, $8,000 deductible PPO plan is equivalent to a silver plan. IQVIA has lower out-of-pocket costs. We have a broader network, pre-tax benefits, and then more generous free wellness benefits for our employees as well. You will be receiving a 1095 tax form. This will be made available in your employee file at IQVIAbenefits.org. So please keep this form just for your records and for auditing purposes. I don't think this is a requirement this year, but you can just keep it for your records and rest well and know that you have that information. And then all of the requirements of healthcare reform are in place here at IQVIA. And so Rachel and I want to thank you for your attention. We thank you for listening. If anyone has any questions, we will now open the session up for question and answers.